One of the common questions patients have about bariatric surgery is what happens to them when they start to have difficulties or struggles. And bariatric surgery is not an end process. It's actually a journey. It's something that patients have to continue to work with because we don't cure obesity. So when patients get bariatric surgery, they're going to have good days and bad days just like they would if they hadn't had bariatric surgery. Bariatric surgery is a tool to help people lose weight. And because of that, patients have to learn how to use that tool. And as patients get further out from surgery, sometimes they forget how to use the tool, or sometimes the tool doesn't work as well as it used to, and things can change. And sometimes patients get upset about that, or they get frustrated or even embarrassed, and they don't want to come back and get help. And the key to being successful long term is to make sure that the patients have good relationships with the physicians, with the surgeons, and with the programs and the teams that are taking care of them, so they can get help when they start to have problems. And invariably, patients are going to have days that are bad. They're going to have potential times that are tough. They're going to have stresses in their lives that occur that make it harder for them to eat the way they're supposed to eat, and make it harder for them to use the tool the way they're supposed to use the tool. We have to encourage the patients to come back and get help. And long-term follow-up is one of the most important things that we can encourage for our patients, to continue to come back and get help after they've had bariatric surgery, even if they're starting to struggle. It's not something they need to be embarrassed about. If they've had some problems and they've gained some weight back, there are a lot of issues that can be at play that we can help the patient with if we know about it. There's several factors that play into why patients could potentially gain weight back after they've had bariatric surgery. There can be educational factors. Maybe the patient wasn't educated well enough before surgery, or they forgot some of the things about how they're supposed to eat and what works well to make them successful and make themselves feel full. There can be psychological factors. Patients do eat for emotional reasons, and sometimes they eat when they're not hungry. The tool is designed to take your hunger away, but patients sometimes do eat when they're not hungry, and we need to evaluate that, and it's usually tied to some psychological factors, and that can be evaluated and brought forth to the patient and be addressed with behavior modification programs. And then of course there's mechanical problems, and sometimes the patients will get upset and get embarrassed and they think it's all their fault, they didn't do what they were supposed to do, and that's why they've gained all the weight back. But in fact, something has gone wrong with the tool is broken, there's not something working the way it's supposed to, and you have to evaluate the patient and look for those problems. In order to do that, the patient has to be there. So I think you can't stress enough to bariatric surgery patients and patients who are trying to lose weight, who have used a tool such as bariatric surgery to help themselves lose weight, to stay in contact with their surgeons and stay in contact with their healthcare teams in order to continue to be successful, even if they've started to have problems.